Thank you for introducing me. But anyway, sorry for interrupting your lunch time. Okay, so today my talk is about quality technology innovations, product comparisons, and complication management. Of course, now you know that biostimulators is skyrocketing in popularity. And I think quality is one of the most effective or most outstanding one up to date. So today I'm going to show you how outstanding the quality are. This is my bio and the content of today. First, I'm going to talk about the quality technology, product comparisons, injection technique, and adverse event and management. First, I'm going to talk about the quality technology. I'm going to start with talking about the equation with quality. What is quality? Quality is PCL, which PCL stands for polycarboxylactone, which is biodegradable, biocompatible, so it transforms into carbon dioxide and water when it degraded. So it's safety, non-toxic, and it can stimulate the collagen. And the technology of manufacturing process of quality, they call it CSAP. CSAP stands for collagenase enable solubilized active and biodegradable polymer technology. What is this one? Normally, as you know, PCL is hydrophobic, but they can transform hydrophobic one to be fully liquid without particle inside the product. So this very, is a patent, it's very special. No one can do this one. I heard that many one try to transform it to be fully liquid form, but no one can done. No one can do it, but only Dexluor can do it. So what is the mechanism of action? When you inject the quality, it's gonna spread into the skin, and then it can stimulate the fibroblast via inflammatory process, and then after that it's gonna have new collagen synthesis, and also the skin becomes thicker and increase elasticity and also the collagen. And then you have the facial lifting and less lines after injecting the quality. And this study, they inject the quality, one of the study about the quality, they inject quality in the rat skin. What happened after that? After 6 hours, the quality spread in the skin, and then they're gonna examine that after 12 weeks. You can see after 12 weeks by histology, there is no residual material and no foreign body granuloma or reaction after 12 weeks, but it can increase the dermal thickness, collagen regeneration, and skin elasticity in the rat skin. So this is very amazing. No particle detected, but you can see the result of new collagen synthesis. And this show at 4 weeks and 6 weeks compared to placebo. With the quality, when you inject, you can see the skin become thicker and new collagen. And it is one of the products of biostimulator that can treat the closed feet at 4 weeks and 12 weeks. And so what is the indication for using the quality? The first one for the fine lines. It's good for the fine lines. And the closed feet, as I told you or mentioned before. And for the clippy skin and the thin skin, dehydration, reduced skin tone, and also poor skin texture. So in the very last slide, I'm going to show you the clinical that I did on the patient. And then you're going to know about the precaution and contraindications. The first one, precaution, do avoid wearing makeup at least 12 hours after injecting the quality, of course like the other injectables. The second thing, you should avoid long-term sun exposure and also the sauna and the heat on the face for at least 2 weeks. And contraindications, the first one, do not inject into inflammatory lesion, of course. Do not inject on the infected skin or inflammatory skin on that point. And then do not inject in the case of hypersensitive to PCL. In the case of pregnancy and breastfeeding, of course, in every procedure. Patient who has history of serious allergy or anaphylaxis and allergic disease, autoimmune disease. The safety and efficacy, as I told you, is biodegradable, biocompatible, and is transformed into carbon dioxide laser, carbon dioxide and water after it degraded. So this is biocompatible, non-toxic. So it's very safe. And one benefit, you don't need to prepare it. Like some of biostimulator, they have to prepare the product. But this one is ready to use. It comes in handy, so you can inject it immediately after you open it. It comes in a syringe with fully liquid. And the characteristic comprise 3S: high speedability, sustainability, and safety. Now I'm gonna talk about the product comparison, and I know all of you must want to know about this one, because now there are a lot of biostimulators that I told you is increasing popularity in nowadays about to inject the biostimulators. And now we have like PCL, GORI on the last one. We have PDO, PLA, PDLA, and CAHA or calcium hydroxyapatite. And this is a detail of each of them. I think each of them have its own advantage and disadvantage compared to one others. But the PCL, in my opinion and my experience, is a nanoparticle PCL 21%. It's very easy to use because it comes in liquid form in the syringe. When you open the package, you can inject it immediately. You don't need to prepare it. But some products like PDO, PLA, PDLA, it comes in the freezing dye powder. So you have to pre-mix with normal saline or sterile water, depend on some brands. Anyway, so sometimes it can clog the needle or the blood cannula. But for the GORI, never been clogged in the cannula or the needle when you inject. And also when you inject, it's very easy, really to inject, and it's less time consuming compared to the others. And the result is very dramatic and fast result compared to the others. So I'm gonna conclude the advantage of GORI. The first one, as I told you already, it comes in handy in syringe with the fluid form, so it's ready to use. You don't need to reconstitute with normal saline or the water. You inject immediately and easy to inject. And you know, as I told you, it's fully liquid. It can spread about 2 centimeters in one point of injection. So when you inject it, you don't need to inject in every part of the face like the other products. When you inject, it can spread. So it's very easy to use, easy to inject, and less time consuming. So if you have the patient, like 10 patients in the line, for the other product, if all 10 need to inject the other biostimulator, at least one case you need like 15 minutes to inject for the full face. But for the GORI, not more than 5 minutes per case when you inject. So it's less time consuming, it's very easy to use, and it's more flexible according to the patient's budget. What I mean? It means like usually you inject 2 ml of GORI per one face, but in case the patient may be uncomfortable with like, because they have limited budget, they can use only 1 ml. So you can inject only 1 ml, but focus on the most problematic part, something like that. But for the other product, you have to open the full one, like a big package compared to the GORI. So in that case, you need less budget And also it has promising result, and the result is very fast. In some, usually, I will inform the patient that it takes like 3 to 4 weeks to get the result. But in some individual, the patient has the, see the effect. I mean the effect of the result at a few days. So that's amazing. So this is the advantage of Query. I'm going to show you the extraction technique. So ideally, we use blunt cannula 25G 50 millimeter and put on the topical numbing cream before, because the product is very painful if you inject without anesthesia. So I recommend to put on the numbing cream before. It's standard. And you can pre-medicate with antihistamine before, about 30 minutes before injecting, and post-medication with prednisolone for a few days. And you can use in combination with toxin and other skin booster. But if you want to inject with the filler, you have to inject like 1 month apart, different session. That's a recommendation of the company. But anyway, if you want to inject the same day, you have to take your own risk, because sometimes it can increase the risk of swallowing that. And then the protocol, I'm going to show you. The protocol normally we use only 2 ml per 1 session. If you inject only on the cheek, so for the beginner, I recommend you to do this one. So the injection point is here, is about 25 degrees to the lateral canvas and down 25 degrees, and it should be 3.5 centimeter away from the tail of the eye. And then you inject in the 3 lines. One line, the upper one, heading toward the nala. The second one heading toward the philtrum, and the last one to the chin. So each is about 0.33, totally 1 ml per 1 side. Anyway, this you can adapt, depends on the patient problem. If you see the patient has the problem on the lower face, you can add more on the lower line. So it depends on your design. But totally, one side is 1 ml. So 2 sides of the cheek, 2 ml. And you should inject in subdermal plane, because we want to stimulate the collagen so close to the dermis with their abundant fibroblast cell. And second protocol, if you want to treat on the forehead too, so you can do the same thing. If you strip to 1 ml per 1 side, you cut off 1 line. Just inject on the upper line and lower line, and you cut off the middle line, and put that 0.33 on the forehead. And the opening hole, it should be 1 finger breadth medial to temporal crest to avoid bruising. So you inject in the toward the midline in 1 line. Only 1 line, it can spread to all the forehead. So this one, if you want to stick to 2 ml per 1 face. But if the patient have more budget, you can add 3 ml, I mean totally 3. So on the cheek, do the same thing like the previous slide, 3 lines and 3 lines. So it means that on the cheek, 1 ml, and the forehead, you can inject 1 ml for the forehead, 0.5 and 0.5, so totally 3. So it depends on the patient budget and depends on your technique, or if you feel comfortable to inject 3. And for the neck protocol, like the same, inject 2 ml per 1 neck. So inject the opening one at the alignment of angle of the jaw, and the upper line go 45 degrees up in the middle and 45 degrees down. So each track 0.33, totally 1 ml per 1 side. So for the neck, 2 ml. That's for the neck rejuvenation, and I found it have good effect on the neck too. And from this one, I'm gonna show you the picture and video of the patient. So please do not take the photo of my patients. So this is very standard injection technique that Dr. recommend to do. So this is the first line. Each line 0.33. As I told you, you can adjust depends on the patient problem. And this one second line. I think the first line gonna lift the nasolabial, second line gonna lift the upper jaw, and lower line gonna lift the lower jaw. But from my technique, I go up on another way. But for the beginner, I recommend you to do the standard first. This is my technique. I inject from downward, from below to upward. And I inject along the ligament. Actually, I have the reason behind the technique or behind the concept, but it's because of time sensitive. I cannot go deep in the detail. So the result, please do not take the photo. So thank you. This case, the patient has skin texture and lines, and also he has static line here next to the nasolabial fold. So after injecting the gory, the line gone. The skin, you can see that the hyperpigmentation or sunspot is better too after the treatment. Oh, I'm going to show you this one too, if you see. Oh, sorry. And the hyperpigment on the chin, if you see. He has been treated many ways with many kind of medication. They were gone. From the history, I think he got this from pedagogic dermatitis. So after 2 weeks of injecting gory, it almost gone. So from my experience, it also not only for the skin texture, the lines and the lifting effect, but it's improved the hyperpigmentation, melasma, and also chronic skin dermatitis like seborrheic dermatitis or many kinds of skin allergy on the face, the chronic skin allergy. So that's one is good. The gory is also good for that condition too. And this one, after gory on the forehead for the static line, you can see only one time is a lot better. Oh, I'm gonna show you this one too. I'm sorry. And as I noticed, you can see the sebaceous gland, hyperplasia and milia. I think they get smaller after injecting. This is my observation. You see, if you compare milia on the forehead before and after, this is only 1 week. This is only 1 week. And I try on the atrophic scar. It's improved. This is about 3 weeks. And also, if you see the skin texture and lines after 1 time of the gory injection. And this case for the neck, you can see the lines on the neck a lot better, and the texture and the creepy skin. And this case, I have come up with the new method of injecting with my own technique. So I try on this case. The first thing, the melasma got a lot better, and also her face lift up. I'm gonna show you this one. Her face lift up. No filler, no toxin in this case. No filler, no toxin, just gory. It has dramatic result. And this is my own new technique that I came up with. So I'm gonna talk about the last topic is adverse event and management. So far there are some clinical trial on the case or the cases of injecting gory. Up to date, there are no serious side effects, just mild and moderate, like swelling, pain during injection, redness, bruise. That's it. One thing that you should know or you keep in mind when you want to inject the gory, it can have something we call overreaction, because gory is a strong biostimulator. It can attribute the overreaction on the patients, but it's not allergy. It can happen. In my experience, some cases it doesn't happen the first time. It got it on the second time, and then no reaction after subsequent time. So it can happen on anyone, but the risk, the incidence is about 2 to 5%. So this thing you have to inform the patient. This can be happen, but it's not allergy. It's just overreaction because of inflammatory response. So it can happen, but it's not dangerous. So usually we pre-med with cetirizine 10 mg 30 minutes before injecting, and home medication with cetirizine and also prednisolone 4 tablets a day for a few days. So management, if the patient have local swelling, you prescribe oral antihistamine and steroid, and indicate who have acute generalized swelling, steroid and histamine the same thing for 7 to 14 days. And for delay localized swelling that can be happen off and on, you prescribe the same thing for at least 14 days. Or in the case who have generalized swelling, even the acute, both either acute or delay, you usually start with injecting dexamethasone first, 10 mg, and then continue with antihistamine and steroid, prednisolone for about 20 mg per day. So anyway, do not inject at the same session as HA filler. And now the company recommend to inject with the blunt cannula protocol. Do not inject with the sharp needle. But you can see in the old protocol, inject with the sharp needle, 5 points per 1 cheek, 5 points per 1 cheek. But they have increased the incidence of adverse events. So I recommend to inject with the blunt cannula. So another thing is a picture of the patient. Please do not take the photo. The patient of DST2024 and my patient. This case, the patient has immediate reaction at injection point. This can be happen. It lasts only a few days. It treat with only oral antihistamines. This may be the needle protocol. So that's why sometimes you inject with a sharp needle and you go too superficial. This can happen. This can happen if you inject with a sharp needle. The sharp needle can get the incidence of bruise, and if you get the bruise, it's gonna be last really long. So when you inject the gori, please be careful. Do not inject and make it bruise, and also the tissue reaction gonna be high if you inject with the sharp needle. If you go too superficial. This case is my case. The first time the patient inject no problem at all. This second time, when you see the case like this, do not panic and get a cool head and inform the patient this is normal. Sometimes can happen. The incidence is about 2 to 5%. This we call generalized acute generalized swelling. This can be happen, but I recommend you to inform the patient before injecting every case, because if the patient got the problem, they're gonna be frightened and panic, but both doctor and the patients. So in every case before you starting injecting gori, you should inform the patient first. This can be happen 2 to 5%, but it's treatable. So for the generalized reaction, acute reaction, you treat with dexamethasone 10 mg and then followed by oral antihistamine and steroid prednisolone 4 tablets for 7 days. And this another case, the patient has swelling around the eyes and lower cheek off and on, almost 1 year, but it's gonna be gradually improve better and better. This after maybe 6 months after injecting gori at the first time, but on the area that the patient have the reaction, there's I didn't inject there. I inject only on the cheek. So this is called delayed generalized swelling. The same thing, you should prescribe antihistamine, prednisolone, or maybe you start with dexamethasone first. But this I got this only one case in almost 1,000 cases that I have it, only one in 1,000 cases. And this case, you see, this about 8 weeks after injecting gori, she has bruise. So we call prolonged bruise that can happen. So once when you inject the gori, please do not bruise the patient. And what is the hypothesis is unclear, but it may be either the hemoglobin mixed with PCL or entrapped by PCL, and when it degraded, it's gonna break down, so it's gonna better over the time. So in my recommendation to prevent, the first thing, make as few punctures as possible when you inject Gori. Stop injecting if there's bleeding. I mean, it cut it in the nip. The same thing, cut in the nip. Check the insertion point. If bleeding at the insertion point, check it. And in case of bleeding in the area of Gori, you flush with normal saline immediately, at least 5 ml per 1 ml of Gori, and that's it. No bruise after that. And the last complication that I found, this case, she has been injected with my colleague. At the initial phase of Gori launching in Thailand, my clinic inject with the sharp needle first, and I think my colleague doctors inject too many points and too superficial. It involved with too superficial injecting. So this happened, you see. This weird, the color is discoloration of every lump, every point. As you see, it's a yellowish orange in color. What is that one? Actually, I don't know. It's no bruise, but it is a color change. So I did the research, and I found that in this case, from the paper below, you can see this case, she inject PCL filler. I think this case inject too superficial too with PCL filler, like Elon said. And the patient got this one, yellowish discoloration around the eye. And then I did the research more. There are some cases that got this problem, especially around the eye, with not only PCL. Some cases got from HA filler, and some cases got it from calcium hydroxyapatite alcohol. And they call this xanthelasma-like discoloration. It's a new, it's a new adverse event of the filler. Not only like PCL, it can happen with any kind of the filler if you inject too superficial. But now that we don't know what is it. This hypothesis is internalization of LDL by macrophages. So the management of the treatment, but in my opinion, please do not inject too superficial. But if you inject with the blunt cannula, it doesn't gonna happen.